Welcome to How to Prevent and Treat High Blood Pressure, Cholesterol, and Heart Disease Safely and Naturally. My name is naturopathic Dr. Eli Klein. I have taken keen interest in this topic since graduating in 2003. I've helped numerous patients and clients. I've written books about this, including Breathe This If You Have a Heart, the book on lowering high blood pressure, cholesterol, and blood sugar naturally, which is available on Amazon. I rolled up an educational program. And I'm also a partner and a formulator with Nanto Nutraceuticals and MHS, my health supplements. And I'm going to also talk to you about a couple of formulations that I created later on in this presentation, formulations that are relevant to the topic of discussion. Having said that, by no means does it represent a treatment. Everything I share with you is merely informational. So let's get started. And the first thing that I want to talk about is the idea that people who are looking for assistance with using natural means to address high blood pressure, high cholesterol, any type of cardiovascular issues, do so because they're generally concerned about the potential of experiencing adverse effects and long-term effects using medications for these conditions, often multiple medications for these conditions. And indeed, side effects can range from low energy levels to sleep disturbances, digestive issues. They can be more serious, increased risk for diabetes, increased risk for short-term memory loss and Alzheimer's. Also, organs can be affected in the long run. There can be decrease in kidney function and liver function, and even heart function as well. And so by no means am I suggesting that you should discontinue your medications here on your own. I'm here just to present natural and safe options that can be used concurrently. And if you wish, you can speak to your doctor about weaning off your medications as your condition improves, should that occur. So let's get right to this. And so what is it that we're trying to address? We're actually trying to address the clogging up of the arteries that can result in a heart attack or stroke. That occlusion, the blockage to blood flow in the heart can cause a heart attack, the brain cause a stroke, or anywhere else in the body can affect other organs as well. And so it starts by arteriosclerosis, which is a hardening of the arteries, and can change into atherosclerosis, which is the formation of plaque that can lead to blockages in the arteries. And so how does that happen? Well, it actually happens because of a damage or injury to the artery wall. And the reason I have a picture here of a scraped knee is because the formation of a blockage of plaque is very similar to the formation of a scab on the skin after a scrape. So when there is a scrape, the body just moves forward to heal that scrape, to replace damaged tissue with new tissue and new skin tissue, this particular case. And as the skin heals, the scab sloughs off. And so plaque in the arteries occurs because of damage or injury to the artery wall. And I'll talk about the nature of that injury. And under ideal conditions and circumstances, it should really never develop or should just slough off, just like the scab on the skin would. But the injury to the knee is occasional, happens every now and then, and the body has the time and the resources to heal. And as you'll see in a moment, the injury to the arteries can be constant, and so it can overwhelm the body and its resources to heal and regenerate. And so that's why plaque, in essence, progresses and grows. And so what is the nature of that damage? And why do I have a picture of a rusted over screw and a bolt here? Because the nature of the damage is oxidation, excessive oxidation. And oxidation is basically the firing of electrons from one atom or molecule to the other, often from oxygen, affecting the nature of the recipient molecule and the nature of its structure. And so in the case of the arteries, the firing of excessive firing of electrons, so to speak, onto the artery wall can result in damage that is similar to the formation of rust. This is just an analogy, something that perhaps is easy to understand because we've all seen rusted over metal. And so that screw, when it's when it's in its pure form and without rust, it's functional. The bolt can go up and down, but as it becomes rusted, it just doesn't function anymore. And so the arteries too, as they become damaged from that extra oxidation, that hardening of the artery sets in, elasticity is lost, and again, plaque can start forming as well. So that has implications to circulation, blood pressure, and so on. And what causes that excessive oxidation? So there are different common sources. So cigarette smoke can be a culprit. And of course, someone smokes many cigarettes every day, that damage is constant. Toxins from pollutants in the air, in the water. Sometimes people work with hazardous material, dangerous material. There can be greater exposure. Excess iron can also cause excessive oxidation. So got to be mindful of that when you get your blood checked. And when you get your blood test results, if there's high iron, you're at greater risk. Heavy metals. And the most common and pertinent dietary culprit is vegetable oil. So things like canola oil, soybean oil, corn oil, type of oil that is commonly used in cooking and industry and all kinds of foods, is the most common culprit. It's rich in polyunsaturated fatty acids, and they have excess unpaired electrons. Okay, I'm not going to get into that too much, but basically very unstable, and it's a source of these excess electrons that can cause a lot of oxidation. There's another type of source of injury or damage, and it is advanced glycated end products and or advanced, apologize for this, or advanced lipid peroxidation end products. And these are basically depicted here on this slide. Where do they come from? They come from predominantly, again, vegetable oil, to some extent sugar, but mostly vegetable oil. And the most common one is this one here, methyl glycol. It's called methyl glycol. You don't have to remember that necessarily, but just know that it basically ends up attaching itself to the artery wall, to amino acids on the artery walls. And I'll get into that. I'll explain that in a moment again. So what is the result? The result is the body tries to heal and repair and replace damaged tissue with new tissue. And it's valuable to know the structure of the artery wall in order to understand what happens and what it is we can do to address this successfully. And so the artery wall consists of 3 layers. Thin layer called the tunica intima, a middle layer, tunica media, and the tunica externa. And plaque actually occurs right here in the middle layer, which is rich in basically a connective tissue, a lot of connective tissue in here in the form of rope-like proteins, elongated rope-like proteins known as collagen and elastin. So you may have heard of collagen and elastin before, perhaps in the context of the skin. It's a structural protein. It gives strength to the artery wall. And those components here basically attach themselves to amino acids on these fibers that run along the artery wall, collagen and elastin fibers. These are rich in amino acids such as proline and glycine, and it's valuable to know that, because if you want to repair it, we need to give the body the building blocks of what it is made of. And I'll get into that again later on in this presentation, this brief presentation. We'll try to keep it brief and concise. So how do you protect against excessive oxidation or oxidative stress? Well, there is an internal antioxidant defense system, or systems. There are several systems within the body that help protect against oxidation. So fortifying these systems will help a lot. And so the first system consists of vitamin E, vitamin C, and a metabolite of vitamin B3. So optimizing these nutrients can help a lot. And the way they work is really, really simple. So this is an example of the outer membrane of cells. Has a lot of fatty acids in here, a lot of lipids. And the concern is that if you have a lipid that has this extra electron, it can fire it at other structures, other lipids, and make them unstable and harm them and cause that type of damage that I'm talking about. So you got to neutralize it. And what vitamin E does helps neutralize it, helps capture that electron. Now, it itself becomes unstable, And so vitamin C comes to the rescue, and it captures it as well, but it too becomes unstable with an extra electron. And then this metabolite of vitamin B3 has a plus sign, NAD plus. And that plus sign means that it has a positive charge, and it actually would like to receive an electron to neutralize it, to make it balanced. And so it turns into NADH. It loses that positive charge, it's now neutral, and it is ready to perform its function. And it actually functions in energy generation within our cells, help the cells produce energy. So this is very desirable. And so optimizing this can be very, very helpful. Food sources of vitamin E include actually the types of foods that are rich in these unstable oils. So nuts and seeds have a lot of vitamin E to protect themselves against these oils. And vitamin C, you find that typically in tropical fruit and citrus fruit and some other vegetables. And vitamin B3, you find in grains and animal protein. And vitamin B3 actually is made from within in the body from the amino acid, the tryptophan. And under conditions of excessive oxidative damage, hardening of the arteries, high blood pressure, it might be valuable to supplement with these types of nutrients. The second system consists of glutathione, and might be a mouthful for some if you're not familiar with this, but basically it's this small molecule consisting of 3 amino acids, glutamate, cysteine, and glycine, and it basically functions in a similar way. It neutralizes extra electrons, basically, and it is preserved. It is preserved by vitamin C, vitamin E, and selenium. That they prevent its loss, its degradation. So those are key to preserving it. And I talked about vitamin C and vitamin E. Selenium, if your diet is rich in non-processed, nutrient-rich foods, you should get plenty of selenium. Brazil nuts are the richest source of selenium. 2 Brazil nuts a day usually give you the daily required intake. But again, other conditions of cardiovascular disease and other diseases, the requirement for selenium increases. N-acetylcysteine is a metabolite of cysteine, which helps replenish glutathione as well. And it's particularly useful in conditions that involve a lot of mucus, like lung conditions that have a lot of mucus. People have those, could benefit from N-acetylcysteine. Again, I'm not treating anyone here, I'm just providing information. And the third system is the superoxide dismutase system. Again, a mouthful, right? But what it is, it's a large protein that is also involved in neutralizing unstable particles. In this particular case, it's an oxygen peroxide with an extra unpaired electron. And so it is heavily dependent for its function on these minerals, zinc, copper, and manganese. So optimizing their intake would be helpful as well. So those are the 3 systems that are needed to help protect against oxidative damage, excessive oxidative damage, and prevent the formation of plaque in the arteries, the hardening of the arteries. What about rebuilding and restoring the artery tissue? What can we do to do that? Well, I mentioned the damage within the artery wall occurs specifically in these collagen rope-like structures. And to rebuild these structures, what's needed, or what are needed, are the amino acids lysine and proline. Lysine and proline are key to the production of collagen. And those are put together, and these rope-like structures are put together by enzymes that are activated by vitamin C, silicon, copper, manganese, and zinc. So those are very important as well. And so when all these resources are provided, then what could happen is that the tissue repairs, and as a result of that, blood pressure normalizes because elasticity is restored. And also what happens is that plaque, much like a scab on the skin, recedes. And so some of the evidence for this actually comes from the work of Dr. Linus Pauling, which isn't featured on the slide, and Dr. Matthias Rath. And I'm featuring Dr. Matthias Rath because he actually conducted a clinical trial to test the use of these nutrients on people with plaque. And he created a formula that combined some of these nutrients and others as well. And in this trial, he gave the formula to one group of people and then a placebo formula to another group of people, and he monitored changes in their plaque. He retested everything within a year or a year later, and he found out that the worst outcome in the treatment group was halt to plaque development. In other words, in none of the subjects in the treatment group, plaque progressed, whereas in the placebo group, in many subjects, plaque did progress and become bigger. What was also interesting, in the treatment group, the best outcome in some people was complete disappearance of plaque and various degrees of regression as well. So great results in the treatment group, and you can look up this study. It's called Nutritional Supplement Program Halts Progression of Early Coronary Atherosclerosis and so on. You can look it up on Google. Now, it's also important to consider what might limit artery repair and plaque regression. And so what might limit that is the availability of energy or the lack of energy to repair. And the analogy for this is really simple. Say I need to repair something around the house, and I have all the tools and the materials to repair. But if I'm tired, if I don't have the energy to do that, then I'm not going to do the work, right? Same goes for our cells. And there are certain conditions that limit energy production to repair and regenerate. And these conditions in particular are implicated in cardiovascular disease. And so the first condition is insulin resistance. The cells are resistant to the hormone insulin and are not able to take in glucose being the source of energy. It's food. You find it in carbohydrate-based foods, and it is a source of energy. The cells use it to generate energy. So under conditions of insulin resistance, cells are not able to produce the energy they need to function properly, including repair and regeneration. Now, how do you know if someone has insulin resistance? Well, the waistline would be more than 35 inches for women and 40 inches for men. Blood tests can reveal high fasting insulin, and there can be other cardiovascular risk factors. CV stands for cardiovascular, such as high blood pressure and high cholesterol. And so this can be addressed by regular moderate exercise. It can be rigorous too, but not excessive. And by limiting excessive stress. Stress is a major culprit that can cause insulin resistance. And there are certain micronutrients, vitamins and minerals that can actually help improve insulin sensitivity and reduce insulin resistance. And these are magnesium, chromium, and vitamin E. Magnesium you can find in leafy vegetables and cacao and certain seeds like pumpkin seeds. Chromium, not a lot of great sources for chromium. A lot of foods have a tiny amount of chromium, but not huge. Brewer's yeast is the main source. And I talked about vitamin E already. And again, sometimes supplementation is warranted. And the other condition that limits energy generation is hypothyroidism, underactive thyroid. Thyroid hormone is the hormone that actually initiates the energy generation process in the cells. It tells the cells, hey, start using up glucose or fat to produce energy. And blood test results or blood tests to identify low thyroid function are not great necessarily. It's not something I'm going to expand on here today. But symptoms are very helpful at detecting low thyroid function. That can include low energy, proneness to weight gain, so metabolism isn't great, and the energy is lacking to repair structures. So people can have thinning hair, brittle nails, and also that energy that also generates heat isn't there, and so a person might feel more cold, and especially their extremities, hands and feet might feel cold. And this can be addressed by sufficient intake of iodine and selenium, because these are the minerals that are needed for the production of the thyroid hormones. Iodine and selenium. You find iodine in seafood, fish, milk and dairy are also a good source of iodine, but a lot of people don't tolerate them very well. And kelp is a good source of iodine. The richer source of iodine is kelp and seaweed. And I talked about selenium already. And also stress. Again, stress is a major cause of low thyroid function. So I want to bring your attention to Healthy Heart Plus. It's a formula I created based on my experience utilizing a lot of these vitamins and minerals with patients, with clients. And I would often recommend supplementation of these nutrients, which would necessitate purchasing a lot of different bottles and opening a lot of different bottles, and can become pricey and inconvenient. So I thought to myself, why not create something that has most of what's needed, as much as I can, put it in one container, make it simple, make it economical. It's a powder, there's a scoop inside. You mix it in water, you mix it in water or juice, you drink it with breakfast and dinner. Or if it's more convenient to take 2 scoops at once, that's fine too. And indeed, these nutrients address underlying causes of high blood pressure, high cholesterol, and poor cardiovascular function. Um, and it comes with a money back guarantee as well. And so I wanted to move forward and talk about the effect of some of these nutrients on blood pressure specifically, and provide the evidence as well. So I'm not just making this up. This comes from the scientific literature. For example, coenzyme Q10, one of the nutrients in Healthy Heart Plus, well known for its heart health benefits. Some medications that are used to lower cholesterol, blood pressure, can actually deplete coenzyme Q10 from our body, interfere with its production, and deplete its levels in our body, which can actually adversely affect the heart. The largest amount of coenzyme Q10 in the body is present in muscles, particularly the heart muscle, our most important muscle perhaps. And so in this particular meta-analysis is a review of numerous studies, in this particular case 12 studies. They suggested that coenzyme Q10 has the potential in hypertensive patients to lower systolic blood pressure by up to 17 points and diastolic blood pressure by up to 10 points. Very impressive for a natural and safe nutrient. And I just want to point that there aren't a lot of good dietary sources for coenzyme Q10. Cow hearts perhaps are the greatest, richest source, but the amount of Q10 you get there is nominal. It's about 3 to 4 milligrams. Compare that to what's required, which is about 120 milligrams to achieve a reduction in blood pressure. Magnesium is another well-known nutrient, can help with blood pressure. Again, this is a meta-analysis, a review of, in this case, 34 trials. And again, they suggested, or they stated, that our findings indicate a causal effect of magnesium supplementation on lowering blood pressure in adults. And vitamin C, we know it's needed to help restore elasticity to the arteries. I just want to make the point that magnesium helps to relax the arteries, helps relax the muscles around the arteries. But vitamin C helps repair the arteries, helps to protect against oxidation, is involved in the repair of the arteries, collagen production. And so that may have something to do with this. And the conclusion was here, again, this is a meta-analysis of several trials. In short-term trials, vitamin C supplementation reduced systolic blood pressure and diastolic blood pressure. I wanted to briefly talk about cholesterol as well, and relay a few key concepts. And if you want more detail, I'll tell you later on how you can get those details. So the first one is the idea that most heart attack sufferers have normal cholesterol. Studies have shown that time and time again. And cholesterol is indeed an important substance that performs many important functions in the human body. It makes important hormones and bile. It provides structural stability to our cells, all kinds of things. Its removal can result in a number of adverse effects because it's so important for our health. You get rid of it, adverse effects can follow. So how do you find out about these adverse effects of cholesterol medications or any medications? You can actually go to this resource, very neat resource, the Prescriber's Digital Reference, also used to be known as the Physician Desk Reference when it was a book, a large, thick book. And you type in the name of the medication down here. You go to pdr.net, I believe, and it will basically provide you everything that there is to know about the medication you're taking, including what are some of the risks. And so certain conditions that lead to cardiovascular disease also raise cholesterol by interfering with its utilization and metabolism. Well, why am I saying that? Because the standard approach to addressing cholesterol is just by interfering with its production. That's how medications work, most common medications work, and some supplements do. Or by binding it and eliminating it through the intestines, flushing it out. But then you're getting rid of it altogether. Now, the most common reasons for high cholesterol, actually these conditions that interfere with its either absorption into the cells to do what it's supposed to do. So you end up with more cholesterol in the blood vessels, but not enough in the cells. Or conditions that interfere with its utilization, making hormones and so on. And so addressing these conditions would actually produce a natural reduction in cholesterol. And these conditions are insulin resistance, poor thyroid function, and stress. And so address these, and excess cholesterol will drop naturally. Well, how can we address these nutritionally? Magnesium can be helpful for both managing the steroid, the stress hormones, so cortisol is made from cholesterol, and addressing insulin resistance and improving insulin sensitivity so the cells can uptake cholesterol with more ease, and that way there'll be less cholesterol in the blood vessels. And I know you can't probably see it here. This comes from PubMed, the database for scientific studies. But various studies have shown the relationship between low magnesium levels and high cholesterol, and intervening with magnesium would drop cholesterol levels as well. This is the daily recommended intake for women and men, 320 for women, 420 milligrams for men. Chromium is another one that improves insulin sensitivity. And can it affect cholesterol? Can it decrease high cholesterol? According to the study, it can. The effect of chromium piconolate on serum cholesterol and apolipoprotein fractions in human subjects, and indeed it showed that total cholesterol and LDL and so on decreased significantly. Okay. And what about thyroid function? We can use iodine and selenium. These are the nutrients that needed to help produce the thyroid hormones. Can they help lower cholesterol? Or indeed, according to one study, iodine supplementation decreases hypercholesterolemia in iodine-deficient overweight women. Being overweight is associated with with having low thyroid function. And another study showed a decrease in cholesterol by using selenium supplementation as well. And you can pause the video and look these up on your own. Same with vitamin C. Vitamin C helps to manage cortisol, the stress hormone, and add that too have shown to help facilitate a reduction in cholesterol at more than 500 milligrams per day. Compare that to the daily recommended intake of only 75 to 90 milligrams. So perhaps supplementation would be warranted as well. Again, all of these nutrients are available in Healthy Heart Plus. It does come with a money-back guarantee, and it can be safely taken with medications in the sense that there are no contraindications with any medications. There is a statement on the back of the brochure that goes with that, should you go in and purchase that or order that online, that if you're taking certain heart medications, blood pressure medications, so on, just monitor your numbers and ask your doctor to adjust your medications as your condition improves. If your condition improves, if your condition doesn't improve, then this is probably not for you. But the vast majority of people have noticed a great improvement, and there are some video testimonials that we've received along with many other written testimonials. And I'm not going to play these right now, but just briefly as an example, this particular individual, his cholesterol levels dropped by 40 points in 3 months. And this particular fellow, he reported decrease in chest pain and decrease in blood pressure as a result of utilizing Healthy Heart Plus, which you can see right here at the basket, in the basket right here. What if stress is the cause of your condition? So I'm going to wrap up in a few minutes, but I just wanted to bring this up because stress is a major cause of cardiovascular disease, and anxiety and worry can contribute to high blood pressure. I've seen this time and time again, and until such time that the anxiety or the worry is addressed, will be very hard to get the blood pressure down in some individuals. And so stress can weaken the heart and contribute to cardiovascular events. We know that for sure. So how do we address that successfully? And various ways to address stress. I want to point out the availability of nature's gift for stress reduction in the form of adaptogens. These are botanicals, plant materials that have come to be known as adaptogens because they help us adapt to stress. They typically, usually help to regulate the stress hormones and decrease feelings of stress, restore calm, and also counter the negative effects of stress on the body, including on the heart and the arteries. So I've listed some of these plants that you might be familiar with. And I also copied and pasted a statement from Health Canada's website as to the statement of effect of one of these adaptogens, the first one on top, Rhodiola rosea, which is a fantastic adaptogen, very versatile, very effective. And so it says in herbal medicine, it is used as an adaptogen to help temporarily relieve symptoms of stress, such as mental fatigue and sensation of weakness, and also used in herbal medicine to support cognitive function, such as focus and mental stamina. And so, just briefly, one of the products I formulated is called Rosiva, and it consists of rhodiola rosea, specifically from Canada, which is very unique to the marketplace. It's used to help address stress, low mood and anxiety, trauma and pain as well, which might be associated with high stress hormone levels. It can be safely taken with antidepressants, anti-anxiety medications, any medications as well. It is contraindicated in bipolar disorder specifically, and most users notice a difference within a short period of time, 1 to 6 days typically. Now, it is what's unique about it is that it's the most potent strain out of 23 that were tested. It started out as a research project of the Alberta Research Council, the Ministry of Agriculture, and the University of Alberta. And so 23 strains were tested, and one was selected, one was chosen, was assigned to a group of growers who cultivated it. It has to mature. It has to be left alone to mature for 5 years before it can be harvested, for it to be ready to have a medicinal value, to be able to exert its function. And the extraction method, preparing it, also has to be very well thought of. And we use a dry alcohol extraction to ensure the potency of the active compounds. So I want to bring that to your attention in case that might be relevant, and that might be a cause, in your case, for whether it's high blood pressure, high cholesterol, or any other health issues might be experiencing, because stress is at the root level of many health issues. If you want to learn more in more detail, perhaps in a more methodical fashion, you can go to nantanutra.com/heart and gain access to 3 key requirements to avoid a heart attack or a stroke. It's an extensive class consisting of multiple videos that come in shorter segments than this particular video. So 9 minutes, 11 minutes, 7 minutes, and so on. And you can watch it at your own pace. And I cover more material in that particular class, which in total lasts about 3 hours. So you can, if you like, you can go ahead and access that. And I'd like to thank you. If you do have any questions, do forward them to me at Dr. Klein at nantanutra.com. Thank you very much for watching.